what if I told you your mouth may be the reason you're tired, inflamed, struggling hormonally, dealing with sleep issues, and just not feeling like yourself? I'm Dr. Toni Engram. I'm a biological dentist, and today I'm going to explain biological dentistry in 10 minutes. Most people think dentistry is just cleanings, fillings, cavities, that sort of thing. But what if I told you your mouth may be the reason you're tired, inflamed, struggling hormonally, dealing with sleep issues, and just not feeling like yourself? I'm Dr. Toni Engram. I'm a biological dentist, and today I'm going to explain biological dentistry in 10 minutes, give or take. And yes, this applies to your kids too. So, what biological dentistry is? Well, biological dentistry looks at your mouth as part of the whole body. With every decision we make, our goal is to support the biological terrain. So instead of asking, how do we fix this tooth? We ask, why did this problem happen? What does it tell us about your overall health? How is your airway, breathing, gut health, sleep, minerals, or inflammation possibly involved? We use materials that are biocompatible. We avoid toxins. We prioritize prevention and nutrition over treatment whenever possible. We support the immune system during treatment, and we prioritize long-term healing over quick fixes. So I'm going to break it down super simple if I can. Biological dentistry focuses on safe and non-toxic materials. So we avoid metals and we use things that your immune system actually likes. Number 2, ozone therapy. We disinfect naturally. We try not to use any chemicals at all, and we use things that support healing. Ozone is really like your best friend. Number 3, PRF, or platelet-rich fibrin. We use your own growth factors for faster recovery and less inflammation. Number 4, airway and breathing. This one surprises people, but mouth breathing changes everything. It changes your sleep, behavior, inflammation, immunity. And for kids, it drastically changes the growth of their jaw. Number 5, oral systemic links. So your gums, your microbiome, your root canals, they all can affect your entire body. So let me give you an example of why this matters. I see so many people who struggle with fatigue, with brain fog, with chronic inflammation, hormone issues. That's a huge one. Sleep apnea, anxiety, skin issues, kids with behavior or feeding issues. And when we fix the mouth, breathing, airway, the oral microbiome, or all of those bugs that are in your mouth, then our patient's health can actually transform. So dentistry is not separate from the rest of the body. It is one of the most powerful root causes. So what does a biological exam look like? This is what I do differently at my practice. Number 1, we evaluate your airway. So open mouth posture, tongue placement, nasal breathing, we are looking at all of that. We check your pH of your saliva because enamel health starts in the mouth and in the rest of the body. We want to see what the pH of your saliva is. We screen for inflammation. So gum inflammation potentially equals full body inflammation. We want to know that. We evaluate any past dental work, things like root canals, crowns, fillings. We are looking at biocompatibility. So how well will your specific body tolerate the different materials that we have? We are looking for things that some people call cavitations. They are just areas of unhealed bone that can be present anywhere a tooth was previously extracted. If the bone doesn't heal correctly, that bone can actually become necrotic in the jawbone. And sometimes that leads to other health issues downstream. We want to be able to see these things. But overall, we are using some just really cool tools like our cone beam CT to personalize your treatment and look in incredible detail. We're using a microscope. We're testing your saliva. We're looking at your entire jaw in 3D, all so we can see exactly what's going on for you. And hopefully going way, way beyond what you've ever had done at just your typical dental checkup. But there are some myths, some of the biggest myths about biological dentistry. Myth number one, it's woo-woo, hippie, new age, weird stuff. The reality is it's actually incredibly scientific and supported by research on the oral systemic connection. So, are there some woo-woo people who love biological dentistry? Yes, there are. But is biological dentistry itself super woo? No, it's actually very scientific. Myth number two, it's just regular dentistry with a fancy label and more expensive. The reality is we use different methods, different materials, different diagnostics. We do a lot that goes above and beyond what we were taught in dental school. That's the idea. It is standard of care plus some, and some more, and some more. Myth number three, only people with health issues need biological dentistry. The reality is, everybody benefits, especially kids. They can benefit immensely from biological dentistry, especially with airway development, with good behavior, with good sleep. Everyone can benefit from biological dentistry. Myth number four, you have to remove all of your old dental work. No, you definitely don't. We want to make an individualized plan for you. Now, if your old dental work is making you sick, then you might want to replace it. And we've got ways to do that safely, carefully, strategically. That's not necessarily all at once. Although some people really go all in and they want to do it all at once. You don't have to. Why I became a biological dentist. I definitely did not go to dental school thinking that I would become a biological dentist. In fact, the holistic dentists were like the tinfoil hat people that my dental school instructors warned me about, because the view in dental school was that those people just wanted to take all the silver fillings out of people for no good reason. Well, turns out that's not true. And what I found was that, like I said before, it's really quite scientific. So still just wanted to be a normal dentist, but luckily God had other plans. I actually got super sick. In 2011, I was diagnosed with Crohn's disease, which is an autoimmune condition. Felt terrible. And my doctors gave me answers that I just did not accept. They gave me the very typical Western medicine answer to Crohn's disease, which was, a list of medications. The medications probably won't work forever, so sorry about that. And by the way, you might need surgery at some point to remove part of your colon. No big deal. And I just didn't accept that. So I had to go on my own journey. I didn't know anything about functional medicine or any kind of holistic care. So I just had to do all the research on my own. I just didn't know any better. And so what I did is that as I figured out ways to feel better myself and to heal my gut, I realized that what I was healing in my gut was the same thing I was treating in my patients every day. Because Crohn's disease was all about inflammation and a dysbiosis, an imbalanced bacteria in the gut. Same thing with tooth decay and gum disease. It's all about inflammation and a dysbiosis in the very first part of your gut, which is your mouth. So as I figured out how to get well myself, I knew I had to figure out how to do the same thing for my patients. So if you want more videos like this, airway, breathing, kids' holistic oral health, real root cause dentistry, I would be so honored if you would subscribe. Let me know what else you want to hear about. And if you're in the Dallas-Fort Worth area and you want a biological approach to your care, you can find us at Flourish Dental Boutique. I will make sure to send the link below.